We did it.
We did it, Jeff.
Hey, success. All right. Good to see you.
Good to see you too, buddy. How's things in Boston?
Things are good. Things are good. It's I'm just gonna get this light out of my eyes. Beautiful summer weather here and hot, but not as hot as the rest of the country, so we're good. There, I got these funny lights in my eyes, so that's pretty good. All
Great.
right. We're on.
We are so on, Jeff. How
Yeah,
do you
awesome. Thanks for having me on. I got my cocktail ready to go for this important hour of discussion.
look for it? Basically sharing our knowledge. I love talking with you, Jeff, about what, the crossovers, what we do, how our specialties. I'll let you describe what you do, but it's the first thing. But I love how we cross over and we can have really interesting conversations. Interesting conversations about lips. Lip,
Oh, yeah.
but why fire away too much time about the 20 plus people that are watching us, and who knows?
Well, you were kind of cutting out there. Can you say it one more time?
Yeah, why don't you go ahead, Jeff, and tell us about yourself and introduce yourself.
Sure. Well, I'm Jeff Spiegel. I'm a Leo. Uh, no, so Jeff Spiegel. I live and work just outside of Boston at the Spiegel Center. We have had our office and practice here for 23-ish years. I've been a professor at Boston University for a long time, and we've had our own center now for 12 years or something like that. We've got 3 ORs, and I'm glad we did this at 9 o'clock because I just barely got here getting out of the office. We are very blessed to be seeing a lot of patients. I work and practice with my wife, Dr. O'Neill, and it's good. We see people for all kinds of things, and of course, we're best known for kind of advanced cranial changes, like for facial feminization, skull surgery, jaw surgery, things like that, revision rhinoplasty, a lot of the usual. How's that for a description? I love, I'll do more. I like paddle boarding and pickleball. What else am I supposed to say?
How about you're my friend?
Yeah, of course.
Jeff and
Yeah,
I,
I'm usually not even on at this time. It's usually O'Neill who does an Instagram video at 9 o'clock at night on every Wednesday for her program interviewing somebody, and I usually get to hang out and catch up on emails or watch Netflix. So this is a fun change for me.
very cool. Well, it's nice that we're able to get together. I'm relatively new to the Instagram Live phenomenon, but I'm enjoying it, and especially when I can get to hang out a little bit with some of my buddies. It was interesting during COVID, uh, although us in Miami were less home than most others, but it was really cool because I got together. I started spending a lot of time with my 4 closest high school friends.
Oh,
And
nice.
one lives in Chicago, one lives in Brooklyn, in the city. One lives in Long Island. 2 live in Long Island, where I grew up. And we've really started speaking like once every 2 or 3 weeks. We did sit there and watch the Yankee game, or just like we were. And by months of doing this, it was sort of like we were hanging out back out and back out strong. My buddy Mark Strong, and we were hanging out in his living room, goofing on each other. And in
Oh,
fact,
great.
yeah, caught the Grateful Dead. We went to Dead and Company in City Field on Saturday evening. We're all turning a magical birthday this year, so we all decided to.
42. I know that number. It's a good one.
It's a good one, right? Practice 23 years, back 29 years. So I guess actually no. How many years has it been? Since '94. Yes, 24 years. What did you start your practice? 97, 98?
99.
You are a baby. So
Yeah.
tell
That's why
Tell
it
me,
looks so good.
what brought you to female or facial feminization surgery, and how did you get involved?
All right. So first of all, I'll tell you, I don't know if it's for everybody, but just to me, your voice is kind of cutting out a lot. So, but I think I know what you asked me.
Uh,
How did I get involved in doing what I'm doing? So depends how far back you want to start. In kindergarten, I was pretty good with puzzles. But moving along a bit, when I was a resident or a medical student, what they give lectures in all sort of the different specialties will give lectures, as you may remember. And I heard someone talking who was a facial reconstructive surgeon, and they were doing free flaps and putting people back together from these most complex injuries and resections. And I thought that is the most disgusting thing I've ever seen. I can't imagine doing that. Of course, that's what I ended up doing. And then I trained in facial surgery and cranial surgery and cranioplasty and microvascular surgery, which was my interest. And I got a job. I was working at Boston University. And one day someone came in and said, I'm a woman who has overly masculine features. What can you do for me? And I said, well, it was a little bit like you're a carpenter who makes tables, and someone says, can you make me a chair? And you go, yeah, I know how to do carpentry. I don't usually make chairs, but I guess I can figure it out. Let me look it up a little bit. Only this time, when I went to the medical literature on how to make chairs, there wasn't any, right? There was nothing there. So I told this woman, here's what I would do, I guess. And expected her to say, thanks very much, goodbye. But she said, let's do it. I was like, seriously? Okay. So we did it. She was pretty happy, and off she went. And I thought that was a very unusual something that I'll never see again. But what do you know? There was a big need. And so more and more people started coming. And then for a new academic surgeon, it was a very interesting thing to say, to realize that in all the books I've been reading for the last decade, there was nothing written on fundamental issues of appearance. How do you know you're looking at a man? How do you know you're looking at a woman? How do you know someone's age specifically? Or interesting, of course, I recognized you as soon as I logged on, but I haven't seen you in a couple of months. So how is it that I recognize you? You said you started hanging out with some old high school friends. You probably hadn't seen them in many years, but you instantly knew them. And they might have gained hair, gained weight, lost weight, and they look very different, but
Usually
somehow
it's
we
for
know.
gain weight, but some of them are
Yeah.
doing better.
Some of them are doing better than this, but you get the idea that they look very different, but you know who they are. So all these sort of fundamental questions of appearance and gender and how we know these things about people were not really being looked at or considered. And so that was a great area for me. It kind of fit my personality, and it fit my desire to sort of answer fundamental questions. And I'm personally more of a big picture person, and I found thinking about these kinds of large issues more interesting on a day-to-day basis than what a lot of people do, which is fine and it's great, it's necessary. But people will argue over do you cut a cartilage graft at 45 degrees or 50 degrees, which is better, and more or less the same. So this really appealed to my personality, and that's kind of how it all started.
So it's really the difference between, and when you say most other colleagues talk about 45-degree cartilage grafts, things like that, it's actually what I think most of them are talking about. And this is a good concept I think we're gonna talk about. We're talking about beauty versus identification. And I think it's fascinating. I think it's fascinating that you focus on identification, or many of your patients do, or maybe that was they gravitated towards you because you were asking the question about identity. I think more primarily in terms of, I think most of our colleagues think in terms of beauty. I'm not saying you don't incorporate beauty also, because you're thinking about the ideal, beautiful, feminine versus masculine face. But there's another issue, and a lot of people, I think a lot of my patients are concerned about how old they look. So it's
Oh,
not a
very
matter
much.
of gender. It's not a matter of gender, or identification. It's not a matter of beauty. It's about the appearance of age.
Totally right.
And I wonder what other concepts. This is actually, I've never heard a conversation like this talking about, Jeff, you know, what would be some other things? I mean, obviously there's function. I don't know if you, can you think of anything else that we typically, you know, oh, that's right. TikTok. Who looks good on TikTok? That's the fifth term. How do you get a good TikTok bob, whatever it is?
Yeah. You know, there have been some really interesting studies on this where if you take if you do a research project, which we've done and which has been done by others, where you take, say, several men's faces or several women's faces and you modify them different ways, and you say to 500 observers, pick of these three versions of this face, which is the most attractive? Or you say, which is the most feminine, which is the most beautiful? And the answers are the same. So it turns out that the most feminine female face is also interpreted as the most beautiful female face. And most of the time, almost always to a limit, it is the most youthful female face. And it all goes back to our fundamental driving force. What is that? Reproduction. So you know that better than anybody. So, so
low blood. I represent that accusation, Jeff.
not at all. Not at all. It's a compliment, I feel. So men maintain fertility till an advanced age. Women don't. And if you are thinking from an evolutionary perspective, how are you going to make sure that people spend their time trying to reproduce with women who can reproduce? Well, it's by making men attracted to youthful faces. So youthful female faces, not masculine faces, but youthful female faces are the ideal of beauty. And, you know, it's popular in certain areas of study, certain feminist studies and other areas, to imply that we all are attracted to youthful feminine faces because the media gives us that. They put it on the cover of the magazine, they put it on TV. But it's the opposite. They're not creating a magazine and putting something out and saying, here, like this. They're trying different things on the cover and trying to see which one you want to buy. And you want to buy that one.
Basically, it's the promise of fertility. You want
promise of fertility.
Wide hips. I mean, you think about the hourglass shape.
Oh, I do, yeah.
Of mention. Interesting.
Yeah. That's what it all comes down to. Everything is about that. And, you know, patients who are young, what are they coming in for? Fuller lips, higher lips, smooth skin, things to make them look voluptuous, feminine. People who are older, what are they coming in for? They want to turn back the clock. They want to look still vivacious, energetic, fertile. And men are a little different. You know, a 60-year-old man doesn't want to look 18, wants to look 50. You know, it's not the same thing because there's still that fertility. So, you know, it's not fair, just is the way it is.
Well, I think also because men have a much longer time scale of when they maintain fertility. It doesn't end at 40. It can go to 50s and even 60s.
Oh, sure.
But what women want to see in men, and obviously I'm repeating the obvious, is someone who can take care of them. You know, that's why they want the strong forehead, you know,
right.
And also potentially even, I mean, you know, these days the fancy car, because that implies a large wallet, you know, and that.
Oh, 100% right. In fact, in the animal world, there's a great example of this, which is the peacock. So peacocks are really called peafowl. That's the species. So you've got the peacock is the male and the peahen is the female. And the peahen.
What's a baby? What is it? What's a baby pea? Is it pea chick?
Good question. I'll have to look that up for you.
Kids has a book about pea. I know it. Yeah, I have to remember that. Anyway,
I don't operate on kids, so I don't know. But so the most attractive peacock is the one with the biggest feathers, biggest, longest, heaviest, most dramatic. Now, that is a terrible liability because these big, long feathers interfere with flight, interfere with your ability to run away, make you a much easier target for the alligator in Florida and the coyote here in Massachusetts to eat you. It's a really bad thing to have. So why is that an attractive feature? Because the male of that species is saying, look at me, I have so much strength, so many resources, I can waste it on frivolous decoration. And that is exactly what a Rolex watch is, or a BMW is.
Hang on a sec, Jeff, your voice, your audio just got weird. Did you hit anything in your...
Oh, no, hands up. Signal issues, maybe. What I was saying is that the frivolous decoration of the peacock feathers is the same thing as a Rolex watch or a BMW. It's the same thing as saying, I have so many resources that I can waste resources on these frivolous items that are not necessarily practical or required, but they indicate to a potential spouse that you have more than adequate resources to care for them and their offspring. So we're not too different from animals. I've certainly been called an animal before.
I want to talk about age because you say you don't operate on children. But let me just try to fix this right now. Your audio has gotten really weird, Jeff. I don't know if anyone else is getting that. Let me try.
Is this better?
No, it's weird. I may have to disinvite you or reinvite you. I lost it. Talk again. Very funny.
Yeah, I don't know. Is it any better? I haven't touched anything.
Huh. Maybe it got connected to Bluetooth, someone suggested. Yes, it sounds weird suddenly.
All right, let me look here at my settings. This is a bad idea, but I'm going to see what I can do. I'm disconnecting the Bluetooth on my phone. All right, does that do anything better?
Not really.
Any better?
Do you want to log off and come back on? We still have another 42 minutes. I'd hate to have it sound like you're...
Yeah, okay, I'm going to log off and come on back.
Okay, I'll invite you. Yeah, log off and come back on.
All right, see you all.
All right, let me invite Dr. Spiegel back. Here we go.
Hello.
Much better, Jeff.
Oh, good. Okay. Well, whatever I did, you fixed it. So that's great. Nice to see you tonight.
I wasn't even the AV guy in school, but and Lord knows I know so little about Instagram, although I'm learning a lot.
Should we start over?
Let's talk about age. Is that all right? I'm sorry.
Anything you want. I'm here until my drink runs out.
An article in the New York Times, in the New York Times Magazine, around 2 weeks ago, this debate about the optimum age of intervention for patients who are gender dysphoric and are seeking intervention. And they talked about the importance of pre-puberty intervention. And I don't want to get you, if this is too sensitive of a subject, I respect that because I realize the implications it carries, especially coming from someone, an expert at you, at least who deals in the surgical aspect, but obviously you understand the psychological aspect. Any thoughts about this debate about the optimum age? And if you want to skip the question, you can just say your audio's not working and we'll go to another question.
No, I'm happy to try to address that. I think it's a very difficult subject. I think that unquestionably there is a group of people who benefit from that dramatically. And I think that it's hard to definitively identify those people. I think you have to believe people when they tell you something such as their gender identity and all those kinds of things and help them sort it out. But it's also difficult to expect a young child to make such significant decisions, which have very big implications on their life when they are children. Uh, so to some extent, there are significant risks to it. Whereas a child who says I feel this way will benefit from those hormones, but an adult who feels that way might say, I want to do things differently. I want to assure the ability to be fertile. I want to worry about this or worry about that, and then deal with this a different way. And it is true that puberty blocking hormones can minimize the need for facial surgery, but I don't think it obviates it. I don't think it eliminates it. And I'm here in Boston where we had Norman Spack and other people at Boston Children's Hospital who were real leaders in that thought process. And I would see the patients they worked on, and they looked better than if they hadn't had prepubertal blockers, but it did not eliminate the benefits of the procedures we do for those people. So I think it's an uncertain thing. I don't pretend to be an expert in that. I'm just happy that the things that I do, have demonstrated value for people and real improvement in quality of life, because we've looked at that. In fact, the most highly referenced paper I've ever written, and it's the #1 referenced paper ever in the journal in which we put it in, was looking at quality of life of people after feminization surgery with us.
Because the article that I was referring to, the one in the New York Times a couple of weeks ago, talked about most patients do very well, with early intervention, but there are some that, just are never going to be happy, and they may want to reverse the course of what was their reaffirmation process. Just summarize, what were your conclusions? Because it sounds like a really interesting article, and obviously they look pretty, but were they happy? Talked about the gender identification. Who are they?
Yeah, it's like I said, it's a tough issue. I think that the people who promote that have a reason to promote it. I have no reason to promote it or not, because, like I said, I know the value of what we do, and it's beneficial to people who were on prepubertal blockers and people who were not. Mm-hmm. So I'll leave it up to the endocrinologists to sort out. But like you said, there is a group of people for whom it benefits, and there are a group of people for whom it was not the right choice. Whereas the things that we do, pretty much unheard of for people to feel like it was a bad choice.
Nice.
Because, just to finish that sentence, even if somebody, and it doesn't happen, but if someone is transitioning and has facial feminization surgery, no one, or vanishingly rare, will people decide to stop that process. But even if they did, they look more attractive. So it's like, the worst thing that happens is you look better. All right. It's not so bad.
Unless you want to look very masculine.
Unless you want to look very masculine, but most studies of attractiveness suggest that the more masculine you look, the less attractive you are in general. And
maybe attractive, but we'll go back to those that masculine, just like that desirability, that protective, the testosterone, muscles, finances, whatever it is. Those are those masculine traits of the beard and the strong jaw and all those other eyes, which is actually, as we're talking about the irony of a lot of guys wanting full heads of hair, is one of the risk factors of hair loss, or one of the, I should say, the etiologies of hair loss, is testosterone. You must have ironic. Must have more testosterone than me, Jeff.
Well, it's a burden, I'll tell you that much.
A little bit, just a little bit.
It's a burden. There's no question.
So ironic that there are some guys, you'd think, well, so that maybe that doesn't necessarily apply, although beards are hugely popular. And obviously, these days, not just beards and guys walking around with the hipster or the Major League Baseball players, but also the desire for beard transplants amongst guys, you know, interestingly, not chest hair, which is obviously which is a strong sign of masculinity, but facial hair. What do you see, Jeff, as the major definitive identification point for masculinity, and then answer the same thing for femininity?
Oh, it's a great question. A little bit of a difficult question, but we have some insight into that from hormones. So if a person is a trans man, that is born with sort of feminine body characteristics, but wants to look and appear male, they'll put that person on testosterone. And it is pretty rare, very, very rare, in fact, for a trans man to need facial surgery, because you can take what is a feminine face, apply testosterone, and you'll have the following changes. You will lose hair on top of your head. You'll gain hair growth elsewhere on the body. Your skin will get all bad. And before you know it, you look like a typical guy. And trans men can take testosterone and disappear, you know, and just appear as all other men with just that, for the large part. It's amazing. Whereas
from the face up, obviously, from the neck up.
Well, yes. So there's surgery or something is typically done for the breasts, either what's called top surgery, or people can wear a binder, which kind of flattens out their chest. Or some people will develop a kind of a beer belly, men's apple shape, and then smaller breasts just sort of look as part of an overweight man's body. And
Green Bay Packers.
Yeah. Perhaps. So, I was trying to think of which team in New York for me to insult, since I'm in Boston, but I won't do it. Would a female with high testosterone experience those things too, if they're not taking testosterone? Was a great question. So I'll answer that one. But on the flip side, if I gave you testosterone blockers and a lot of estrogen, your skin would look better. You might get a little bit of hair growth, and it's not going to do a whole lot more for your facial appearance. Some people think that after enough time, you'll get some more fat deposition here in the front of the cheeks.
And I'll pee better, right?
Certainly, it'll be a longer line to go pee, for sure. That's definitely the case.
My prostate, right? Typically.
Yeah, your prostate will shrink. Exactly. Yeah, that's might be worth considering. So anyway, it's interesting because in some ways it is the default appearance to look male, right? So it's looking masculine is easier to achieve with hormones, and looking masculine, everyone starts to look more masculine as time passes. Your grandmother looks more masculine than she did when she was 18 years old, because, as we talked about earlier, that femininity goes away.
Right.
Yeah, I meant my grandmother. So, yeah, a good point. So somebody asked the question, what would happen to a woman without exogenous testosterone? Would it have an effect? And yes is the answer. So you have women who have, say, polycystic ovary disorder, and they'll have an imbalance, or what we consider an imbalance, in estrogen testosterone. And yes, they will get frontal bossing, widening of the jaw, or and more masculine features. And once that's controlled, those are people who will come for facial feminization surgery, because we can undo that. And I also have a steady stream of women bodybuilders who decided to take testosterone for a while in bodybuilding times to jack up their muscles, and then discovered that their voice deepened, their facial features coarsened, and maybe after stopping the testosterone and deciding, I'm no longer a competitive bodybuilder, those features didn't resolve. So they'll come in and we'll help undo that work. of the hormone. So the answer is both exogenous and natural. And somebody asked, how can that be controlled with blockers? Yes, blockers or surgery. If there's a source in your body that's secreting the hormones inappropriately, that can be removed. Or if it's something that you need, like your adrenal gland or something else, can be controlled with different kinds of hormones. And then some of the surgical procedures which we do, which are very safe, can undo anything that happens.
Now, before you talk about the default or the ideal female look, the female characteristics, isn't it interesting? Because you said by default, it's male. In other words, without the presence of estrogens, they'll look male. Sort of, I think, I don't want to paraphrase you wrong, but it isn't interesting that in utero, without hormones, the default is a female. Am I correct?
I think that's right. Yeah, I think that's right. So it is interesting, and people used to talk about, was it Jamie Lee Curtis, who had like an inability to respond to testosterone, and so developed as an attractive woman.
Yeah.
Yeah. So you're right, absolutely. But certainly for appearance purposes, it's pretty easy to look masculine. And if you want to take a stereotype of this, a lot of stereotypes are wrong, but some of them have a kernel of truth. But there's the stereotype, and no offense.
Me, right?
Well, you're just the stereotype of the masculine men we were talking about earlier. But the stereotype, no offense, women, is that women take longer to get ready to go out. And like tonight, you had me on as your guest at 9 o'clock, and I said, usually my wife, Dr. O'Neill, does her 9 at 9 program with someone at this time. And I know that there's a torrent of activity in our home before she goes on, as she does her hair, puts on makeup, et cetera, et cetera. And I pretty much pulled over a chair, poured myself a drink, and sat down. And I look awesome. And the reason that I didn't require much effort is because it's easy to look masculine, and it's hard to look feminine and attractive feminine, even for an attractive woman like my wife. It's hard. Everyone requires some efforts to look good. And the ultimate, as my patients say, I just want to, I'll see patients who come and say, I just want to roll out of bed, in a pair of dirty sweatpants and look gorgeous. I'm like, well, everyone does, like, I'll date myself here. Christy Brinkley wants that too. It doesn't happen for anybody. Maybe for Christy Brinkley.
David, it reminds me of a Jerry Seinfeld where he talks about cotton balls. What is with I don't know a single guy that knows how to use cotton balls, yet I don't know a single woman that doesn't have cotton balls in her closet. What are they for?
I just know you put them in your ears when your wife's watching something you don't want to watch on TV.
That's why we don't use it, see?
Yeah.
So let's talk about, let's talk about the concept of feminine. What are some of the most important characteristics of being feminine? And I can tell you from my perspective, which is what I see all the time, is that I really just focus on from here up. And actually, one thing I will tell you, you mentioned something about not having it. I wanted to make an analogy from eyebrow transplantation. I can't remember what that is. Never mind. It doesn't matter. But maybe we're talking about what you're born with versus what you want. Mostly, what I do is I'm reversing what people what people lost, which is the regaining of hair or maintenance of hair, including or what they overpluck, such as the restoring of eyebrows. Really, the only thing that I don't do that born with, well, obviously the transitioning patient where I do beard transplants things, but is the patient that's born with an overly high hairline, and I'm doing probably 4 or 5 of those every week now, the hairline lowering surgery, which I want to talk about in a minute because that's one of where our practices overlap. Talk about women. What are the ideal? What are some of the men looking for besides pretty nice skin and potentially an upturned nose? What are some, and a smaller jaw? What are some of the other features?
So this
not male, or they're looking for pro female?
Well, that's the $64,000 question, as they used to say. So it it's becoming more and more known. And we've been working on this for 20 years. But what allows me, what would I have to do to you so that you looked unquestionably female? And you could say, is it the hairline? Well, sure, that's part of it. You could put me in a nice wig with no temporal recession, nice rounded corners here, right? And I'm not going to look like a woman.
No.
And I don't have any beard, but you could like get rid of all the hair on my face. It's going to help, but it's not going to do it. And so
By the way, before you do that, don't get rid of it with laser, because if you're going to be transitioning, Jeff, and come to me or anyone who's thinking about transitioning, but let's use these beard hairs and let's stick them in the scalp. And actually, it's something that I do.
that's a great idea.
Yeah, we don't want to waste them, but because it doesn't leave scars and it allows the hair get that much more hair. But talk more, Jeff. I'm
No,
sorry.
that's a great idea. And Dr. Epstein just pointed out for everyone watching here is that hair is precious, and it is at the current time a limited resource. There are only so many on your body, and you can shuffle them around, and no one does that better than they do at finding hair where there is none and putting it where you want it. So absolutely, moving around hair is important, but hairline's a big part of it. And we were taught when you were in school and when I was in school, we were taught all these angles, the angle of the nose, the angle of the face, the thirds of the face, all these things for beautiful faces. But not too many people adhere to those measurements. And if you see a woman, a beautiful woman, and her nose is a little acute, you don't think that's a man. And so these things are not it. It's probably a lot more related to light. Men have small eyes, small dark eyes, generally deeper set, often with a glabellar ridge that shadows them. Why do men have a glabellar ridge? No one knows. One of the thoughts is it's protective. If you're going to get hit in the face, it doesn't hit your eye. You've got like a shield protecting your eyes. Men also have flatter anterior cheeks. Everyone comes in saying, my cheeks are great, and they're pointing here. Yeah, that's it, but this is bad. And this is where a lot of women go to get fillers. And this is a big, important sign of youthfulness, big, important sign of femininity. And in the youthfulness part, why? Because you need to have a short eyelid.
The convexity, concavity in the mid-face area.
That's it, exactly. Your eyelid, your lower eyelid should be almost non-existent. Should be like a series of eyelashes and then right into your front cheek. And so we're doing blepharoplasties and things to tighten that. People are coming to see my wife from all over to get tear trough filler because she does that really well, and you have to get it just right to balance it between the eyelid and the cheek. And we fill in that area, and that's probably creating a reflector, right? It's like people who don't live in Florida with their precious few months of sunshine will sit outside with those mirrors in the old days before we knew sun was bad to get that tan, and it's reflecting light up. And this is like a bouncer. It's bouncing light into your eyes, makes your eyes look really big. And we also want a lot of light around the mouth. You and I go like this. I can't see any of my upper teeth. I can't see any of your upper teeth. You can't see your grandmother's upper teeth. But I can tell you on your daughter, on that good-looking girl on television, on that beautiful woman in the music video, you can see their upper teeth because that's creating a light around the mouth. And when you know about the lip lifts, people come in to see me and they say, oh, I hear my lip's supposed to be 1.1 centimeters or 1.4 centimeters. That's nonsense. It has nothing to do with the measurement. If you're 5'1", your lip's going to be shorter than if you're 6'1". But what matters is seeing that brightness, that light. So we've probably been thinking about things wrong, kind of measuring what we can until we understood it better. But these are the kind of things you want to think about. Hollowing, temple hollowing, all the things that people are doing, they do it because they know it looks good. But why does it look good? It has to do with light reflections to a large extent. So your question, though, I got sidetracked. Your question was...
Wait 1 second. And then I guess that's the concept of beards. It's dark, takes away
Yeah.
lightness.
That's right. And women have smooth skin. So
what is the teleologic, what is the evolutionary basis of? That's a very deep question.
No one knows, of course, but one theory is that the female of a species evolves opposite from the male in certain characteristics solely to be opposite and identifiable. Because it doesn't do you any good if everybody looks the same and you don't know, it's a random luck if you mated with the right person. Like it doesn't work. So you have to be able to identify who is a fertile, attractive mate. And so if men have flat anterior cheeks, women are going to have full. If men have a long upper lip, women are going to have short. It's sometimes just the opposite. That's one evolutionary theory.
Sort of like it's sort of like the Washington Monument versus the Martha Washington Monument, which is the DuPont subway station.
I didn't know that. That's interesting.
The Annie and the Audi.
That's so interesting. That's it. I did not know that was a Martha Washington station. I know it's a very long escalator.
They say that's the Martha Washington many years ago. So actually, while we were talking, you mentioned ethnicity, and that may be another age. We talked about identification of gender. We talked about beauty, what people are looking for, and a fourth thing is ethnicity. Any thoughts about for the gender reaffirming patient, but how gender fits, how ethnicity fits.
Well, I've spoken about, as you know, over the years, a few things that have been like my recurring themes. One is trying to understand what features, like why we find things attractive, and finding it mostly in fertility and gender. And I've talked a lot about lip lift. And one of the other things I've talked about is, I can't even remember what I was talking about. One of the other things, I really can't. What did you just ask me? Tell me again. I got distracted. You can't see what's going on behind me, but there was a distraction.
Don't put
it's almost like a TikTok video, which has happened.
You think I can remember? No, we were talking about the
Say it again. You faded out.
The role of ethnicity.
Oh, ethnicity, right. Well, the third thing I've been speaking about over the years is that these measurements and things we got taught don't make any sense. And I said it before, we got told about 3, 4, 5 triangles for the nose and 105 degrees of rotation here. And the width of your nose has to be exactly the width of your eyes, and all these things that were in all the books. And I used to go to meetings as a young professor and kind of quietly say, but that doesn't apply to Asian faces or African faces or anyone but German faces, frankly. And it doesn't make any sense to me because there are a lot of beautiful people and those numbers don't work. So why do we keep talking about that? And so I think that proves my point in some ways, that there are beautiful people of all ethnicities. And we know they're beautiful, and they don't adhere to those numbers. And this has been studied in all kinds of interesting ways. This is really great stuff. So, for example, they'll take, we'll do it for women. They'll say, take the most beautiful women in Miami, or at the University of Miami, we'll say, and they'll ask all the guys, well, let's make it Ohio. I went to Michigan, so we'll pick on Ohio. They'll take the beautiful women at Ohio State, and they'll rate them. They'll have the men at Ohio State pick the 10 most beautiful women from a group. And then they'll do the same thing in a tribe in South America, deep in the jungle, someone who doesn't get exposed to television from the United States. And they'll say, who are the best looking women in your tribe? And they'll tell them. Then they'll show the women from the tribe to the guys in Ohio, and they'll show the women from Ohio to the guys in the tribe. And everybody picks the same winner from the other group. Now, the guys in Ohio think that the girls in Ohio are better looking than anyone from the tribe. And then people in the South American tribe think that everyone in their tribe is better looking than the women in Ohio, but they still know which was the best looking one in that group. It's amazing. And this gets repeated against any possible combination. And so who you are particularly attracted to has a lot to do with what you're used to. If you grew up in a multicultural community like New York or Miami, then you're going to be attracted and find attractive many more different kinds of faces than if you grew up in a very homogenous community. But, in somewhere in the central of America, maybe there aren't so many homogenous communities anymore, but you still recognize beauty. And so it's the race part of it, people find their own race attractive only because that's who they're exposed to. But everybody knows who's attractive.
It's like the old saying, what you find wonder as a child will hold you forever. When I was 16 years old, I was touring Europe. I used to be a violinist. I was touring Europe, and I drove through the country of Yugoslavia, and I fell in love with Yugoslav women. Guess what?
That stuck.
One came into my life.
That stuck. Maybe the violin didn't.
What about the violin?
I said the Yugoslavian women stuck, but the violin didn't, maybe.
The violin did. The violin didn't. So let's talk about, let's go a little more into the mundane, the more technical. Let's talk about hairline lowering surgery. You and I are arguably two more experienced hairline lowering surgeons in the country. I know you combine.
I don't want to argue about it. I agree.
About you agree with what?
No, I said I'm not going to argue with you. I agreed with what you just said.
Cool. So let's talk about one of the, I don't know, share with me a couple of thoughts about how to get good results with hairline long surgery. What's your philosophy towards that? And also the age, the youngest age you will work with, you'll do it on a woman as well as on a man.
Sure. So for me, the key to hairline surgery, as far as if you're a good candidate or not, is really two things. One is there a defined hairline for me to advance? So unfortunately, my hairline's a little thin. You can't see this, I'm sure, but my hairline's a little receded and thin.
No,
you can't see it because of the quality of the foam.
Really? Come
yeah.
a little closer.
It's hard to believe, but
Yeah.
maybe you can see it because you're one of the world's experts in this, but I know none of the viewers can see this.
Nah.
So where would you make an incision on my head where there is dense enough hair that's the obvious edge of the forest, right? It's like saying, there's a forest behind my backyard where I've got a little bit of grass. I know where the start of the forest is because there's some pretty dense trees there. But if you've got 3 trees in your yard and there's a grassy field, it's not really a forest. So there's not really a clear spot to advance. So that's one of the first things I think about for men or women is there enough density that there's a spot for me to hide an incision where it's going to heal nicely.
And not just density, but also stable. It won't,
stable.
Very low chance of thinning out in the future.
That's the second characteristic. Is that advancing edge going somewhere? Because if you did a hairline lowering surgery on me 10 years ago, I'd have a nice incision right here across my head with nothing behind it for another inch. Well, you can't see that, but you know what I'm saying. So that's exactly it. So you want to make sure. So would I do it on a man? It's a man who has to tell me, has to understand this concept and definitively tell me that my hairline hasn't moved in years. And I have all my relatives, their hairlines don't move, and they have to be ready to talk about getting hair grafts if it does move because they're going to have an incision there. And they have to kind of understand those things. And for women, typically it's the same characteristic, but you're much more likely to find someone who has nice thick hair, just a high hairline who wants it brought forward. Do you feel differently about it, or do you have more or less the same?
Well, I would add that the other important characteristic is adequate mobility. If I can't advance a hairline by at least, in most cases, 16 millimeters is my cutoff, somewhere between 10 to 15 millimeters. Typically, my average one is around 21, 22 millimeters. There was Doug Seidel's group in Northwestern just published an article in our journal. It was literature review, or sort of like what do you call it? Those studies where they look at all the other studies. They found the average amount of lowering was 16 or 17 millimeters. I wouldn't be satisfied with that if that was my average amount of lowering. I think you really need to do on average 20 to 22 to get consistently good results and have happy patients in most of your patients. I do think, though, that you need adequate mobility. As long as I can bring the hairline down anywhere at 12 millimeters or more, I will go ahead and do the procedure, mainly because the density so far surpasses what I could even achieve with 2 transplants. So even the only downside is you're leaving a fine line scar, which in my experience are only around 15% of patients feel it's indicated to do some graft to soften that because there's not enough hairs growing through the scar. But I also like, even if the patient's not going to do graft further lower the hairline, usually hairlines are within 15 millimeters, 10 to 15 millimeters of that junction of the vertical forehead and the horizontal scalp. And the problem with most high hairlines, particularly on, a lot of my female patients that have come to me for this, is that they're not right at the junction. They're not in that like one side junction. They're above that. That's masculinating, and that is masculinizing, and that is also, it makes someone look older potentially.
Absolutely.
So as far as, so that's the other indication. In terms of the age on I generally won't do these on men under the age of 35 or 40, simply because I don't think we can fully nor adequately predict who is going to lose hair. There are exceptions, however. For example, guys that have zero family history, and and they won't, usually guys will, even if they know that I won't do it, if there's a risk of it, most guys are honest and they'll say, yes, my mom's brother has a little bit of hair loss. Boom. That's enough for me to say, we got to watch you for at least to your 30, 28, 30-year-old, something like that. And as you said, if you're going to get the procedure at such a young age and you do lose hair in the future, you'll need grafting, which isn't necessarily the worst thing in the world, because you bring a hairline down, you're saving them potentially 8,000 grafts or 6,000 grafts, put their hairline lower. Then if it does recede, as long as they understand that to keep that hairline where it is, that it'll just take more grafting. They still have a virgin donor supply, and you've got plenty of grafts, and meanwhile you've saved the first 6,000 grafts or 8,000 grafts that were obviated. The need was obviated because of the hairline loan surgery.
Absolutely right. Yeah, I fully agree. And we published a paper on that, how much we advance to, and it's for what I'm doing. A lot of the time, I'm trying to advance on the sides significantly more. And for a lot of people, women as well, I'll say, if you really want to advance this and they have a bit of a forehead mass, I'll say, let's take down that forehead mass at the same time, because then I'm going to get more play and I can lift this up, bring this forward, and we're going to bring the hairline relatively closer in that way.
Yeah,
it's yet another way of advancing the tissues.
This is a surgical tip, because one thing I've added to my technique to really get that rounding, and I do agree, and many times it's the rounding which is as important, if not more important, but sometimes grafting. But what I do is two things. Number one, I generally like to avoid making a coronal galeotomy, because I do find that it puts a greater risk of hair loss on the hairline, which is unacceptable, and fortunately very few of my patients have that. I become much more aggressive and undermining, going all the way back to basically the nuchal line. In terms of, the two things I do to get the best rounding out, I will sometimes do lateral coronal galeotomies. I'll just do it in the lateral, maybe 3 centimeters, 2 centimeters, and so that will loosen it up. That will give me an extra 2 to 4 millimeters of lowering. And the other thing I do is I tack the galea in the corner. I make my incision like this, and then I come back. I grab the galea and I tack it down to the temporalis muscle, so it pushes it down, as opposed to pushing up a lot of brow, shortening the forehead by much to get that pulling down. I'd much rather secure it deep and then place the eyebrows wherever the patient wants them, or whatever the patient expressed is his or her desired position.
That's a great idea. Yeah, we do something very similar. And I'm always trying to take this point and bring them together.
Yep.
Rounding is very, very important. And, for some people,
except for the male, of course.
Except for, right. But for women, we'll often get this area forward here, 2 inches. And somebody who's got good laxity and we've got a big brow and had a low eyebrow,
Hmm.
you can get a big change. And like you said, you don't want to advance it all consistently. So it's much more about the shape. Although, like you said, again, you definitely want to get it off kind of this horizontal top of the head and really onto the juncture or junction. Yeah. 7:30 tomorrow morning is my next one of those.
Oh, I have one too,
Yeah. Awesome.
but I'll be starting at 6:30. I like to start early so I can be home.
6:30.
I can be home. I like to be home by 5:30. So I like to start a little early. I love it when my patients say, "Wow, God, doc, you work so hard. You work so early." It's like this is what I've always done. Is I've started work early. We are blessed in many ways in what we do, but one thing we're not able to do is work from home for the most part.
No, it's
Other,
very,
other than some telemedicine for consultations, which I'm sure you developed or you evolved quite a bit during the last 3 years, which now has become, let's actually talk about that. Out of town patients. We have 3 more minutes. Out of town patients. What do you, how's your practice composed of out of town patients, and any special things you do to make them feel like they're, local?
well, about 85% of our surgical patients are out of towners. And it has been forever. I was just talking about this tonight with someone, and we sent in a paper to one of the big plastics journals that's going to come out any day talking about a little over 2,000 video consultations of people prior to COVID, because we were doing this for years, so have a lot of experience there. What we try to do most importantly is to make it an efficient visit. So most people will do a video consultation, feel comfortable, book their surgery, and meet me the day before surgery. We'll have 24 hours to sort things out if there's anything missing. Do the surgery the next day. I'll see them again the day after that. And then, depending on what they had, they either stay at one of the hotels with which we have a relationship for a week, or they can go back home and then get stitches taken out at home, or we can do something dissolving. How about for you? Something similar?
Yeah, in fact, well, for mostly, what I'm doing is most of them are transplant patients. You're actually maybe the only doctor I know that has a higher percentage of fly-in patients than I do. Mine is probably 75%. Uh, Webcams are important, photo reviews, but I would say probably 30% of my out-of-town patients I don't meet, not even by webcam, not even virtually, until the morning of surgery. Of the other patients that fly in, 70% I will do a webcam. This way I can evaluate their scalp mobility, or I can discuss with them, I can evaluate the donor area better. I've developed these skills to be able to assess donor density, from thousands of miles away. But yeah, they'll come in the morning of. I'll meet with them. They have the option to come in the day before. I'll meet them in the morning. Unfortunately, I have a network of doctors in all the major cities. I'm sure you've seen a couple of my patients, New York, and for hairline lung surgery, that's the only patients that I really do procedures on that require suture removal. But
Yeah.
and these days, my a place for people to come visit. That's one of the nice things that we've had.
Oh,
Any last
absolutely.
any last words, Jeff, or anything you want to share with those that are out there, or anything
Yeah.
about
So for anyone listening, if by some reason they don't know who you are, Dr. Epstein is one of the world leaders in hair surgery and beard reconstruction and eyebrow reconstruction. And he can even put hair in your nose if you want that. He's amazing with hair. Are you taking hair out of people's noses yet? Putting it elsewhere?
haven't tried that yet. I've used probably the most odd place I've harvested hairs from with a big toe for eyebrow restoration.
Wow.
And let me tell also about Jeff. Jeff and I have, been friends for a number of years, but that's not his greatest claim to fame. His claim to fame, of course, is also he's a wonderful guy and a family guy, but also, and a very funny guy. But Jeff is, well known as arguably one of the world's top facial feminization, but also parlays that knowledge and skills to being a very highly respected and highly sought after facial plastic surgeon. It's great hanging with you this evening, Jeff, for an hour.
Yeah, I feel like I didn't know we could fill an hour, but I think I could keep going. You're a great host.
Well, it's been wonderful to have you as to do this with you, I should say. And I'll see you soon. Thank you, everyone, for attending. You're welcome to reach Dr. Spiegel. If you have any questions, I'm sure he'd be happy. Just go to his website, as you can go to my website, or I guess through our Instagram sites,
Yep.
Instagram pages. But anyway, it's been a pleasure, buddy. Have a good one. Say
Thank you.
hi.
Have a good night. Bye-bye.
Good night. Bye.
Can you text him to record?